Preface to first edition. This book is mainly about antibiotics, but embraces sulfonamides and other synthetic drugs employed in the chemotherapy of the microbic infections of temperate climates. That of malaria and most other protozoal infections, helminthiasis, and malignant disease is excluded. The first part describes the properties of antibiotics and other drugs, with emphasis on their degree of activity against different bacterial species. The large body of detailed information on this presented in a series of tables, some of it hitherto unpublished, provides one essential basis for rational prescribing. Since the first requirement of any drug is an adequate and preferably high degree of activity against the species responsible for the infection. The second part is concerned with chemotherapy in its practical aspects, in infections which are classified by systems. As professional bacteriologists who have had no clinical responsibilities for many years, we are fully conscious of our temerity in invading the sphere of therapeutics. Nevertheless, each of us has been so frequently consulted by clinical colleagues about the treatment of individual patients that we can claim a knowledge of this subject in its practical as well as theoretical aspects, and feel justified in writing of what we have learned. The treatment we describe is solely that directed against the microbe. We are well aware that other kinds of treatment, quite outside our sphere, are sometimes an important element in success, and moreover that circumstances may exist, again beyond our ken, which can modify the usual indications for chemotherapy. The clinician must be the ultimate judge. Our aim has been to provide him with as much factual